నమస్కారం అండి. నా పేరు డాక్టర్ సత్యనారాయణ గర్రే. ఐఎమ్ కన్సల్టెంట్ నెఫ్రాలజిస్ట్ అండ్ ట్రాన్స్ప్లాంట్ ఫిజిషియన్ ఇన్ అపోలో హాస్పిటల్స్, జూబ్లీ హిల్స్. ఇప్పుడున్న ప్రస్తుత పరిస్థితుల్లో కిడ్నీ జబ్బులు, షుగరు, బీపీ ఇట్లాంటి వాటి వల్ల కిడ్నీలు పాడైపోవడము, డయాలసిస్ మీదకి వెళ్ళడము ఇవన్నీ చాలా ఫ్రీక్వెంట్గా చూస్తున్నామండి. సో వర్కింగ్ ప్రొఫెషనల్, స్పెషల్లీ యంగ్ పీపుల్కి డయాలసిస్ అనేది ఒక ప్రాబ్లమాటిక్ ఇష్యూగా తయారవుతుందండి. సో ఇట్లాంటి వాళ్ళకి ట్రాన్స్ప్లాంట్ ఈజ్ ఆల్వేస్ ఎ బెటర్ ఆప్షన్. సో హౌ ట్రాన్స్ప్లాంట్ విల్ హెల్ప్ యూ ఇన్ చేంజింగ్ ఇన్ ద క్వాలిటీ ఆఫ్ లైఫ్. మన క్వాలిటీ ఆఫ్ లైఫ్, మన దైనందిక జీవితంలో ట్రాన్స్ప్లాంట్ ఏ విధంగా మనకు ఉపయోగపడుతుంది అనే దానికి మా పేషెంట్ మిస్టర్ శ్రీధర్ గారు మీకు తన మాటలో చెప్తారు.
Thank you. Good morning, everyone. So my name is Sridhar Mogli. I am a Satyanarayana patient. So I was being diagnosed with the kidney failure 2 years back. I was with high BP and uncontrollable BP, and then also I have a arthritis problem. So I was going through a very typical situation and going to work and all. It's become a very hectic and all. So I couldn't able to my work-life balance and all. So one fine day I been recommended to go under dialysis. So from there my entire life is got changed. So I was totally went into depression. I couldn't able to take care of my family, even myself. So it was very hectic situation for me to deal with the time. So thanks to Satyanarayana doctor, he was kind enough, and personally he was as a brother, he helped me a lot during the dialysis. He convinced me to get into dialysis, and he pushed me also to get the dialysis done very frequently. I was trying to skip the dialysis and almost give up my life, and he used to motivate, and then he used to give assurance like you will be coming back again. So he buys some time from me so that he can be assured like I'll be leading a normal life the way he has said during my last 2 years. So I been get into the transplant after 1.5 year with the help of Satyanarayana doctor, and he was kind enough to take care of personally, and then even at surgery point also he took care of end to end, arranging the hospital admission, then testing, and after transplantation also he was keep on following up like how is my situation and condition also. So slowly I think I even went into the depression mode, and even slowly I started recovering from that after my transplant, and now I am leading very normal life. Even I am working for a big MNC, and trying to move out of India very soon to pursue my opportunities abroad. So thanks to Satyanarayana doctor. Thanks very much for Apollo.
నమస్కారం అండి. మా అబ్బాయికి కిడ్నీ ప్రాబ్లం ఉండే, డయాలసిస్కి కూడా సహకరించని మా బాబు ప్రాణాల మీదకి విరక్తి పుట్టి మా బాబుకు సత్యనారాయణ డాక్టర్ సహాయంతో ఏ టైంలో కానీ ఏ వేళలో కానీ ఫోన్లో అందుబాటులో ఉండి మాకు చాలా సహకరించి మా సమస్యను, మా కిడ్నీ సమస్యలను పరిష్కారం చేసిండు. ఆయన ద్వారా మాకు మళ్ళీ మా కొడుకుకు పునర్జన్మనిచ్చినట్టు ఇతని సహకరించిన టైంలో కూడా మా బాబుకు ఓపిక చేసి సహనంగా చెప్పి మందులు ఇచ్చి, ఏ టైంలో సమస్యలు హెల్త్ ప్రాబ్లంలు వచ్చినా కూడా ఆ సమయంలో మందులు ఇచ్చి సహకరించి 1 సంవత్సరంన్నరలోనే మా కిడ్నీ ప్రాబ్లం లేకుండా కిడ్నీలు ఇప్పించి ఆపరేషన్ చేయించి మా బాబుకు పునర్జన్మనిచ్చాడు డాక్టర్ గారికి ధన్యవాదములు. మళ్ళీ మాకు మా అబ్బాయికి ఎప్పుడో వస్తుంది, బతుకుతాడా లేదా అన్నదానికి ప్రాణదానం చేసిన ప్రాణదాత డాక్టర్ గారు సత్యనారాయణ.
So basically this is one of the classic example అండి, how patients on dialysis, especially young people and working people, feel when they have to come 3 times a week for dialysis in the hospital, and post dialysis కొంచెం వీక్నెస్ ఉంటుంది, బాగా నీరసంగా ఫీల్ అవుతారు. They feel very tired, and to continue as a professional during dialysis would be little challenging. But I'm not discouraging dialysis by saying this. Dialysis has changed a lot in the last decade, and it has extended the life. Until life prolongation lo dialysis chala help chestundi. But young patients and working professionals need a better quality of life, which can be achieved by undergoing transplantation. So when I saw this patient, he was really depressed. He was not willing for dialysis also. I have to motivate him a lot, and we made him register in Jeevan Daan scheme. He was not at all doing it. So personally I have to monitor all those things, and then because I was pretty sure that young patient like this who was working in MNC, his life went upside down when he was diagnosed with kidney disease, and he was requiring dialysis. dialysis, post dialysis, he was having lot of weakness and he's unable to do his routine activities. He has to quit his job for 6 months and all those things. Now once the dialysis is done, first 3 months he was a little restrictions and all was there, but slowly he recovered, and for the last 1.5 year he was doing really well, and he was back on his feet. He is doing his job, and now he is planning to move abroad. And the point I'm raising here is the quality of life changes a lot once you undergo transplantation. So to undergo transplantation, we have two options. One is the Jivandan scheme, which is available in Telangana. So the residents of Telangana who are undergoing dialysis can register in this scheme. And the other one is a living donor transplantation. If one of your family member is willing to donate to you, then we can do transplant. So these are two options we have. And for all the people who are undergoing dialysis, I always encourage them at least to register for the Jivandan scheme, so that they'll have a fair chance of getting transplantation and then lead a normal life once post transplantation. Thank you.